Hello everyone, I'm Arnab Guha from Impeccable Innovations Private Limited. We are a startup from Bangalore, India. Today we are going to discuss about cardiac health and food thy medicine. Let thy food be thy medicine when possible. This review paper was published in 2018 in European Journal of Pharmacology. There is still a debate about the popular phrase, let thy food be thy medicine and medicine be thy food, often ascribed to Hippocrates of 400 BC and used to emphasize the importance of nutrition to prevent or cure disease. Interestingly, it is almost certainly a historical misquotation, as the saying does not appear in any of the recovered Hippocratic documents. However, even more, some of the scholars argue that Hippocrates and his followers would probably disagree with the principle in the literal sense. Notwithstanding this, nutrition has been a central element in many traditional forms of medicine until its role in the curative medicine start to decline during the last century. However, following the increased awareness of the importance of lifestyle for disease prevention, we are now facing a renaissance of nutrition or lifestyle in general for disease management as well. In this context, disease management not only comprises lifestyle interventions to improve general health and well being of patients, but also nutritional strategies to stabilize or even reverse the disease process itself. Some of the chronic diseases are directly now associated with unhealthy lifestyle, specifically obesity, cardiovascular diseases, type 2 diabetes, and its comorbidities. To set the context right, let us look at the four thumb rules on gut. Almost 2362 years ago, Hippocrates in 340 BC said all diseases begins in the gut. It's really amazing to see that Hippocrates had the vision and the knowledge. The second thumb rule of the gut is 90% of body serotonin is made in your gut. Serotonin is a monoamine neurotransmitter. It influences learning, memory, happiness, as well as regulating body temperature, sleep, sexual behavior, and hunger. Low serotonin can be due to genetics, stress, chronic pain, and nutritional deficiencies. The third thumb rule of gut is 70% of your immune system is from your own gut. Nutrition is a key modulator of immune function. Foods we eat affect the diversity and composition of bacteria and other microbes in the gut, which in turn affects the immune cell. Those gut bugs are healthiest and support strong immunity when their host, that's us, consume nutritious plant-based food that are rich in fiber, also have a balanced diet altogether. And our fourth thumb rule of gut is your second brain. There is a constant communication between gut and the brain. Gut uses the same chemicals and the cells as the brain to help us digest and to alert the brain when something is amiss. Now let's talk about cardiac health. Almost 2 years ago, we saw cardiac emergencies in Gujarat surge during Navratri among young revelers, younger hearts losing their beats. Now let's check the cardiac emergencies in 2025.
Karnataka has become the first state in India now to make sudden heart attack deaths legally notifiable, a bold move in response to a deeply unsettling trend. In recent weeks, over 60 sudden cardiac deaths have been reported from Hassan and Chitradurga alone, involving young people. In fact, it's shocking to see some college students, techies dying without a warning, dropping dead like that, leaving families in a state of shock. Now, Health Minister of Karnataka, Dinesh Gundarao, says all hospitals mandatory will have to report any sudden cardiac deaths in 24 hours time. And also what's important is that they've ordered autopsies. The autopsies are now mandatory, especially for cases outside hospitals. Autopsies will be done on those people who have died suddenly of a cardiac arrest, a heart attack. A centralized database is now going to be maintained to keep special focus on young, seemingly fit people dying of cardiac-related problems. Officials say the move will only help.
Let us understand the difference between cardiac arrest and heart attack. Heart attack is a circulation problem, while cardiac arrest is an electrical problem. Cardiac arrest usually occurs suddenly and often without warning. Electrical malfunction in the heart causes an irregular heartbeat, arrhythmia. With its pumping action disrupted, the heart cannot pump blood to the brain, lungs, and other organs. When this occurs, a person loses consciousness and has no pulse. Death occurs within minutes if the victim does not receive treatment. And what is heart attack? Blocked artery prevents oxygen-rich blood from reaching a section of the heart. If the blocked arteries is not reopened quickly, the part of the heart normally nourished by the artery begins to die. Longer a person goes without treatment, the greater the damage. So, heart attack is a circulation problem. It's important that if you are experiencing any type of heart issues, you should take a proper consultation from cardiologist doctor. Here we will discuss 3 different tests which you can discuss with your cardiologist doctor. The first one is a D-dimer test. D-dimer is a protein fragment that's made when a blood clot dissolves in your body. Blood clotting is an important function. Normally, your body will dissolve the clot once your injury has healed. D-dimer is normally undetectable or only detected at a very low level unless your body is forming and breaking down significant amount of blood clots. Healthcare providers most often use D-dimer test to help determine if someone is having a blood clot condition, which includes DVT, which is deep vein thrombosis, PE, which is pulmonary embolism, DIC, which is disseminated intravascular coagulation, and stroke. Usually, the value of the D-dimer test you will get less than 250 nanograms per ml of the blood. If the D-dimer high, then there is a chance that there is more micro blood clotting or macro blood clotting happening. The second test which we discuss here is homocysteine test. Homocysteine is an amino acid that the body uses to make protein. Homocysteine test is advised if you are at high risk for heart diseases. It also helps to detect deficiency of vitamin B6, B12 and folate, which are necessary for metabolism of homocysteine. Diagnose homocystinuria in newborns and infants. Normal homocysteine level is between 4 to 15 micromoles per liter. Increased level of homocysteine in the blood is called hyperhomocystinemia, which is classified into moderate one, which is between 15 to 30, intermediate one between 30 to 100, severe hyperhomocystinemia when the readings are more than 100 micromoles per liter. Excess level of homocysteine can build up in the arteries, which may increase your risk of blood clots, heart attack and stroke. Eating a well balanced diet can help maintain the right amount of vitamins in the blood. As a result, your homocysteine can be metabolized in a proper way. The third one is the troponin test. Troponin is a type of protein found in the muscle of your heart. Troponin isn't normally found in the blood. When heart muscles become damaged, troponin is sent into the bloodstream. As heart damage increases, greater amount of troponin are released in the blood. Usually, the normal range of troponin 1 test is below 0.04 nanogram per ml, which indicates no heart injury. When the troponin concentration is between 0.04 to 0.39 nanogram per ml of the blood, then it may require a series of troponin tests, and your cardiologist will be able to work with you to understand what is the exact level of the heart injury. Let's talk about a fourth test as well, HSCRP. The high sensitivity C-reactive protein test is a blood test that measures low level of C-reactive protein in the blood. CRP is an acute phase protein produced by the liver that increases significantly during acute inflammation or infection, rising to level over 10 milligrams per liter. And these are the 3 different levels and risk categories of HSCRP.
Difference between a heart attack condition and a cardiac arrest. Ideally, cardiac arrest may you will not get almost any chance of survival. वो आपका इलेक्ट्रिकल फेलियर हो गया आपके बॉडी का और तुरंत चांस है कि यू मे डाई. But in case of heart attack, if it is a massive 2 minor heart attack or a micro heart attack, you will still get some chance of revival. अगर कोई आसपास वो तो उस टाइम पे आपको ले जाए या CPR दे दे उस टाइम पे. Difference between a heart attack condition and a cardiac arrest.
The right diet matters. Typical diet in Western countries does not contain enough fiber. This insufficient level of fiber intake adversely affect the bacteria in the gut microbiota. Therefore, the immunity and the health of the host is compromised. And host means us. An abundant and varied consumption of dietary fiber helps in maintaining a diverse and healthy microbiota, which produces enough metabolites that contributes to human physiology and better health. So it's important that we focus on what type of diet we are eating each and every meal. So let's hear from Dr. Sanchita. She is MBBS and currently working in the preventive and promotive health lifestyle medicine specialist category. She is the founding director of Holistic Health Center for Integrative Medicine in New Delhi. She is also author of Amazon bestseller book Holistic Health Over Medicine. She is also an expert of COVID-19 prevention at the AIMS Delhi in the Prakshamay project.
Hello, Dr. Sanchita. I hope you had a great time here in the today's breakfast pe charcha meet.
Yes, it was absolutely fantastic. I really enjoyed the information that Arnab Guha had to share with us. Everything was very, very crucial. The information regarding vaccinations, regarding...
Hello, Dr. Sanchita. I hope you had a great time here in the today's breakfast pe charcha meet.
Yes, it was absolutely fantastic. I really enjoyed the information that Arnab Guha had to share with us. Everything, food, the importance of millets in today's diet, and I totally agree with all of these. Very great inputs from various examples, and I hope many of you will be actually consuming these wonderful products which are full of good proteins, good fats and good carbohydrates, and lots of nutrients, lots of fibers in them, and which will definitely help you become disease free. Thank you so much, Arnav, for this wonderful session.